On behalf of the National Hispanic and Latino Addiction Technology Transfer Center, I want to welcome you back to this four-part learning series on substance use disorders in the Latino population. This is Module 4, and the focus of it is stimulants. We want to make sure that you understand that the views, opinions, and content expressed in this module do not necessarily reflect the views, opinions, or policies of the National Latino Behavioral Health Association, also known as NABLA, the Center for Substance Abuse Treatment, the Center for Substance Abuse Prevention, or the Substance Abuse and Mental Health Services Administration. And once again, we want to welcome you and thank you for taking on Module 4. The mission of the National Latino and Behavioral Health Association is to influence national behavioral health policy, eliminate disparities in funding and access to services, and to improve the quality of services and treatment outcomes for Latino populations across the U.S. The executive director of NABLA is Frederick Sandoval. You see his picture there. The objective is to provide national leadership on mental health and substance use concerns of the Latino community. NABLA's policy priority areas are the following: targeted capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of counselors, therapists, and other behavioral health practitioners in the field, funding for co-occurring disorders of alcohol and substance use, opioid crisis in the Latino community, as well as suicide prevention. So those are the policy priority areas for NABLA. Once again, we want to draw your attention to this busy slide, but the gist of it goes as follows. There are many technology transfer centers with very specific focuses across the country that are funded by the federal government. In this case, we're talking about SAMHSA, through the two centers, the National Center for Substance Abuse Treatment and the National Center for Substance Abuse Prevention. And what we have there is the prevention technology transfer centers, the mental health technology transfer centers, and the addiction technology transfer centers. These are sister centers. Their main objective is to provide training, capacity building, and support to individuals and organizations doing work across the country to address substance use disorders and mental health challenges at the state and local levels. So I want to encourage you to take full advantage and to go to the websites to see what trainings and technical assistance are available. And there you will see the instructions on how to request and access those very services that are helping many across the country. And once again, we represent the National and Hispanic Addiction Technology Transfer Center. We're one of those specialty centers, but there are others who focus on Native Americans or African Americans. There are others who focus on different populations in different regions of the country. Once again, it's a plug for you to take advantage of this important resource. In terms of the mission of the National and Hispanic and Latino Addiction Technology Transfer Center, it is to provide high quality training and technical assistance to improve the capacity of the workforce serving Hispanic and Latino communities in behavioral health treatment and recovery. We disseminate and support the implementation of evidence-based and promising practices to enhance service delivery, promote the growth of a diverse, culturally competent workforce, and bridge access to quality behavioral health services. We are committed to increasing health equity and access to effectively culturally and linguistically grounded approaches. So that's our mission. Here you see two very competent staff of the National and Hispanic ATTC. And they are the director, Dr. Susie Villalobos, and before joining NABLA, Dr. Villalobos worked with academic institutions and nonprofits as a public advocate and researcher. She did this by implementing and managing clinical and social behavioral studies and programs. Her expertise in working with local, state, and federal agencies stems from her associations with community-based organizations focused on activities committed to focusing in on health disparities among Latino populations living and working on the U.S.-Mexico border. You can see the rest of her bio there. She is very competent as in terms of her experience and as the director of the National Hispanic and Latino ATTC. We're also privileged to have Ana Chavez Mancillas. She has a master's in social work, and she is the program specialist at the National Hispanic and Latino Addiction Technology Transfer Center. Prior to her position, Ana worked with Pacific Clinics for over 18 years, providing bilingual and bicultural mental health and substance use services to children and families. Over the years, she held different roles within the Pacific Clinics, including substance use specialist, case manager, therapist, program coordinator, team supervisor, and program director, amongst other things. Once again, very competent. You can read the rest of her bio to yourself. We encourage you to get a hold of the staff at the National Hispanic ATTC with any of your questions around training, technical assistance, and the other services that are provided there. I am today's presenter. My name is Janet Hernandez. I am originally from Puerto Rico. I live in Massachusetts. Here in Massachusetts, I am the director of the Latino Addiction Counselor Education Program. We're funded by the Department of Public Health. In another role that I have here, I'm clinical supervisor at a federally qualified health center. We do MAT/MAR, medication-assisted treatment and recovery services. We do HIV services, and we also do hepatitis C services. We've cured over 200 people of hepatitis C with a 99% cure rate. In addition to that, I do a number of consulting work at the national level with federally funded programs and agencies. I've worked in every single state except the state of Alaska. It brings me to work on the ground to meet and work with people like you who are doing awesome work. I get to learn from and make contributions to that. In terms of my preparation, I am a certified prevention specialist. I'm certified and licensed as an addictions counselor, and I work across the continuum with over 34 and a half years of experience. I have a PhD, as you can see from my credentials, and I also have a GED. And my GED I got in prison. It was more difficult to get a GED in prison than to get a PhD out here. I am a person in long-term recovery from substance use disorders and mental health challenges, which for me means that I haven't used a drug, including alcohol, for the last 35 and a half years. That enables me to be a productive member of my familia, my community, and to be able to do this type of work and meet excellent people like you. As I said before, today is Module 4, and it's all about stimulant use disorder and treatment. We're going to get straight into it. Once again, this is Module 4, and we encourage you, if you haven't already done so, to take in Module 1 on alcohol, Module 2 on tobacco, Module 3 on opioids, and to encourage your friends, colleagues, co-workers to do the same. We hope that this module is going to be helpful for you and for the people that you work with on the ground. In terms of the outline for this model, we're going to do an introduction to stimulant use. We're going to talk about stimulant use in the Latino population. And we're also going to talk about screening and treatment of stimulant use disorder in Latino populations. And many of the tools that we're going to talk about are applicable to other populations as well. So that is the outline. We want to ground this module, as we did others, in how we deal with substance use disorders among the Latino, Latinx, Hispanic population living in the U.S. We draw knowledge from the DSM-5, also known as the Diagnostic and Statistical Manual of Mental Disorders. We use this manual to help us assess and diagnose people with a substance use disorder. And so the DSM defines a substance use disorder as a constellation of behaviors involved in compulsive drug seeking, including impaired control of substance use, impaired social interactions with others, because of substance use. This includes family, friends, co-workers, that sort of thing. Risky drug use. The example here is substance use in hazardous settings and pharmacological changes. These are when people experience withdrawal symptoms and the like. We know that addiction at its most severe chronic stage of the substance use disorder diagnosis, which is characterized by substantial loss of self-control, manifesting in compulsive drug-seeking behavior, despite the desire or attempts to discontinue those behaviors. If you haven't been trained in the DSM, we encourage you to do so. It's a very important tool. And the latest version, the DSM-5, isn't that old. So please take advantage of additional training that's available. The question for this module to consider is, what are the risk factors for stimulant use disorder? What are the risk factors for stimulant use disorder? Some of you might have some of these answers readily available. Good if you have them. For some of you, you might be saying, well, I don't really know, and that's why I'm here. And so that's a good starting place as well. We're going to share with you some of those risk factors. Beginning with gender, men are more likely than women to use almost all illicit drugs. However, women have the same risk factors as men to develop substance use disorder. And then psychiatric disorders, people with depression, attention deficit disorder, and other psychiatric disorders are more likely to abuse drugs or use drugs, including stimulants. Alcohol use. Alcohol shares a common metabolite and extends the high of stimulant use. It's something to think about by way of a risk factor. And as we go through this module, you'll see more on stimulant use. So here we are, we're going to get straight into it. In terms of stimulant drugs are used globally to produce euphoria, increase confidence, sociability, energy, and wakefulness, and reduce hunger. So you see the many usage that stimulants have. These drugs include a broad spectrum of natural and synthetic compounds, but cocaine and amphetamines, particularly methamphetamine, have been a focus of attention because of the global scale of their extra medical use and the serious harms related to their use, not just here, but all over the world. The types of stimulants, it's important to cover that. So we're talking about cocaine, crack, meth, speed. Those are more shorthand terms for the different types of stimulants that belong to a highly addictive class of drugs frequently used in the US and beyond. Stimulants increase alertness, attention, and energy while also elevating blood pressure, high heart rate, and breathing. And while stimulants such as Adderall and Ritalin are legally prescribed for conditions such as attention deficit hyperactivity disorder, recreational versions such as cocaine and methamphetamine are illegal. Cocaine is an illegal drug made from the coca plant that's often injected, snorted, or smoked. Methamphetamine is an illegal and particularly potent amphetamine drug. And then prescription stimulants such as Adderall, Direxine, Ritalin, and Concerta, which are used to treat attention deficit hyperactivity disorder, as previously mentioned. And then MDMA, commonly known as Molly or ecstasy, which has stimulant and hallucinogenic properties. So that's laying some of the groundwork in terms of what some of the stimulants are. And then here, we give you a list of street names so that you become familiar, because many of your clients might not use the scientific terms. They're going to talk about the street terms that are used. So in terms of amphetamines, it's R-Ball, Skippy, the Smart Drug, Vitamin R, Kibbles and Bits, Speed, Truck Drivers, Bennies, Black Beauties, Crosses, Hearts, LA, Turnaround, Uppers, Amps, Pick-Me-Ups, those sorts of names. And then for cocaine, it's Coke, Snow, 8-Ball, Flake, Powder, Dust, Candy, White, Kryptonite, Cookie, Strong, Speedball is cocaine and heroin mixed together. so that you know some common street names. Now, if you haven't heard some of these, it might be because of regional differences. And if you have heard of them, maybe it's because you're speaking with your clients and they're sharing these names, or you've been to training and you're speaking with people who are in the know, including colleagues and that sort of thing. So there you have it, some common street names. In terms of these drugs and where they are available, and this is talking about many different countries and not just the US. You see it here. The light blue there is cocaine, and the darker shade of blue or purple is amphetamine. And so you see there with the depiction in terms of where the availability is and what it looks like, so that you have an idea. This is particularly important if you're working with immigrants from these parts of the world, right? This will give you an understanding of what might have been available to them in their country of origin. We know that cocaine is trafficked from source countries. Mainly we're talking about Bolivia, Colombia, and Peru, through transit countries to markets in North America and Europe. Amphetamines, primarily methamphetamines, are manufactured using precursor chemicals in laboratories, so their production is geographically wider. Methamphetamine can be efficiently synthesized from pharmaceutical ephedrine and pseudoephedrine with readily available chemical reagents. Its ease of manufacture has created lucrative burgeoning markets for amphetamines in lower income countries that have weak regulations on precursor chemicals. Many of these drugs are produced in other countries and then trafficked into the US. More on methamphetamines. The first wave of meth epidemic in the 1990s, we heard a great deal about, and early 2000s, was worse in the southwestern part of the United States. This included Nevada, New Mexico, Oklahoma, Arizona, and Utah, and all have meth mortality rates greater than 7 in 100,000. New hotspots have also emerged outside of the Southwest, largely in places hit hard by the opioid epidemic, including West Virginia, Kentucky, Tennessee, Indiana, and Ohio. You heard me say that I live in Massachusetts, and we have seen hotspots of methamphetamines here as well. In terms of annual average rate per 100,000 adults age 18 or older, this is between 2015 and 2018. White non-Hispanics had the higher proportion of methamphetamine use disorder, 7.5%, followed by Hispanics at 6.7%, followed by other non-Hispanics and blacks non-Hispanic. So you see the figures there by way of annual average rate for adults. Again, this has implications for understanding disparities, for planning, implementing, and delivering services at the community level. Methamphetamine, a Schedule II substance under the Controlled Substances Act, can be inhaled or smoked, swallowed in pill form, snorted or injected when dissolved with water or alcohol. It's important that you ask your clients if they're using methamphetamine, how is it that they're using it? This will give you additional information to think about. So, when you think about people injecting anything, you immediately want to think about how do you reduce harm so that they don't get infected with HIV or hepatitis C, those sorts of things. As well as when people smoke, what are the instruments that they're using for smoking? Are they shared instruments? Are they their own instruments? That sort of thing. As well as what type of where they're getting their water to snort or inject, or the alcohol that they're using as well. So all of these things are not just mere information for you to have; they have implication for helping our folk stay healthy, get better, and enter into recovery processes. The street names that we talked about for methamphetamines include speed, meth, and crack. We talked about those before. Crystallized methamphetamine, known as ice, crystal or glass, is a smokable and more powerful form of the drug. Methamphetamine use causes a euphoric experience that can alter brain functioning, memory, decision-making, mood, and potentially damage the central nervous system. These drugs are extremely dangerous. Chronic or long-term methamphetamine use can result in irreversible psychological and physiological damage to individuals. Some points here to remember regarding methamphetamine. A person can overdose on methamphetamine because methamphetamine overdoses often leads to a stroke, heart attack, or organ problems. The first responders and emergency room doctors try to treat overdose by treating these conditions, right? And many have been trained in acknowledging that that's what's happening with people and then to treat them. Methamphetamine is highly addictive, as we said earlier. When people stop taking it, withdrawal symptoms can include anxiety, fatigue, severe depression, psychosis, and intense drug cravings. Those are things to know because, you know, when we treat people, one of the first things that we want to do is to help them detox off of these drugs. Researchers do not know yet whether people breathing in secondhand methamphetamine smoke can get high or experience other health effects, but people are studying this. It's something to keep in mind. To help people err on the side of caution, we encourage people we encourage you when working with people is to say, listen, we don't know if that secondhand smoke is going to hurt your children, your family member, that sort of thing. If you are going to smoke, please do not expose them to that secondhand smoke. Amphetamine use, acute effects include hypertension and tachycardia, increased confidence, sociability, and energy, as well as suppressed hunger and fatigue. Users can later experience irritability, as I mentioned earlier, restlessness, anxiety, depression, lethargy, and insomnia. Amphetamine can be ingested, snorted, and less commonly injected, as we mentioned earlier. Here are the legal amphetamines: Adderall, the Dextrin, Vyvanse, Ritalin, and Focalin, so that you know what the legal amphetamines are. And then when we think about MDMA, a synthetic substance abbreviated from that long, complicated name that you see there, commonly known as ecstasy. It is commonly found in tablet or pill form, can also be found as powders or capsules. Its effects slightly differ from the amphetamines and other stimulants. So we're talking euphoria, increased sensory awareness, and mild CNS stimulation. Know that it was in the news earlier this month that many of these drugs, when they're being produced in tablet form, are being produced in tablet forms that look a lot like candy with very attractive colors to young people and kids. So that's something to think about as we think about prevention and keeping families and kids primarily healthy and aware of what they might be putting into their mouths and systems. MDMA is primarily ingested, but it can be snorted, inhaled, or injected in powder form. We've mentioned that multiple times. The products sold as Molly often contain synthetic cathinones instead of MDMA. The drugs are referred by different names, so Bliss, Cloud9, Lunar Wave, Vanilla, Sky, and White Lightning. Cat, here spelled with that H, is a herbal product consisting of leaves and shoots of the shrub Catha edulis. Fresh leaves of cat contain the stimulants cathinone and caffeine, both of which increase the release of dopamine from CNS dopamine terminals. Cat's natural range extends throughout East Africa, from Ethiopia, Eritrea, and Somalia through South Africa. It's also found in Rwanda, Zaire, Malawi, and Zimbabwe, for you to be aware of. Again, if you're working with people who are recent arrivals from those regions of the world, it's important to understand. In terms of cost of stimulant misuse to society, it is a huge burden and a huge cost. In 2018 there were 27,342 stimulant overdoses, roughly 40% of all overdoses, of all overdose deaths in the United States. Stimulant-related offenses accounted for more than 75% of all federal drug offenses. Again, 75% stimulant-related offenses accounted for. And then amphetamine-related hospital costs totaled $436 million in 2003 and increased to $2.17 billion by 2015. You can only imagine what that's doing today in 2022. So the costs are huge in terms of misuse to society. And as we all know, that these figures represent individuals, families, and entire communities. So the impact to individuals, families, communities is huge, and we should all be concerned about those. In terms of social cultural factors of substance use related disorders, we're coming back here to the etiology of substance use disorders and the social cultural factors. Substance use prevalence rates for Latinos mirror those of the general population in the US. The number of indicators of assimilation to US culture as well as social demographic variables predict substance use amongst Latinos. Some of those are gender roles, including, as an example, machismo, attributed primarily to males, English language proficiency, regional differences in patterns of substance use within groups of Latinos, and immigrant generations at risk for mental health problems. Again, we always draw attention here so that people understand that, even though we talk about Latinos, Hispanics, and Latinx people, we are very diverse. And so it is important to understand what the regional differences are, what the patterns of substance use are, immigrant generations who arrived here now, who's first generation, second generation, that sort of thing, and obviously the intersections with culture. Access to treatment, we know that Latinos have less access to substance use treatment and must wait longer to access such services as compared to non-whites. Some of the disparities in treatment that occur within the Latino population can be resolved through increased availability of culturally informed treatments. It's not only access, it's quality of care. Those are two different things. They go hand in hand. But we know that access is hindered and then quality of care. And many of the components that are missing in those programs where access and quality of care is hindered have to do with cultural elements, such as language, right? Such as having people who are from those communities that can provide services, assessments in the primary language of Latinos, Hispanics, or Latinx people. So some things to take into account by way of ideology and social cultural factors. We're going to move on here to screening and treatment of stimulant use disorder in Latino populations. And we see that we have a number of screening and treatment tools. These include the self-report ASUS-R, Adult Substance Use Survey, the APA Substance Use Disorder Criteria, motivational interviewing as a strategy, as a technique that has been proven with evidence to work, and then cognitive behavioral therapy, or CBT, another evidence-based model that is currently used in our field to treat people with many different disorders. So how is stimulant use disorder diagnosed? Doctors use the American Psychiatric Association most recent criteria for substance use disorders to identify stimulant addiction. For someone to be considered addicted to stimulants, he, she, or they must meet at least 2 of the 11 criteria, which include an inability to reduce consumption, cravings to use a stimulant, continuing to use a stimulant despite it causing relationship problems, and needing to use increased amounts of stimulants to achieve the desired effect. In terms of health effects that are noteworthy here, among the things that I mentioned earlier, cocaine and methamphetamines are highly addictive. And withdrawal symptoms include strong cravings for the drug, mood swings, insomnia, hallucinations, and headaches. The effects of chronic stimulant use may include paranoia, anxiety, confusion, and decreased sexual function, as well as potential damage to the respiratory, cardiovascular, and central nervous systems. Chronic methamphetamine use has additional mental and physical side effects such as aggression, hallucinations I mentioned earlier, tooth decay, sores, weight loss, and aging skin. As with some other illegal drugs, stimulant use can increase a person's risk of suicide. Here we shift to adult substance use surveys, so the ASUS-R as a tool, which contains all scales of the original ASUS, which is a 96-item psychometric-based adult self-report survey comprised of 15 basic scales and 3 supplemental scales. It is appropriate for clients 18 years or older and may be self or interview administered. The ASUS-R, I should say, meets the needs of self-report instrument that is an essential component of a convergent validation approach to the assessment of patterns and problems associated with the use of alcohol and other drugs. These surveys require that we as practitioners, as providers, know what they are. This is a mere introduction. We always encourage you to get further training if you haven't been trained. And if you're going to encourage anyone to self-report, it's important that we know what we're talking about in terms of these scales and the 96 items and the like. So how is a stimulant use disorder treated? Behavior therapy. So behavior therapy is the most effective treatment for stimulant use disorder. One such method, contingency management, gives patients tangible rewards for positive behaviors, aiding their efforts to stop using stimulants. Contingency management is supported by SAMHSA, and there are tools in the SAMHSA clearinghouse, and there are tips and taps that help people to understand contingency management. The most effective in treating a substance use disorder involves psychiatry, emergency medicine, general internal medicine, in terms of most effective. Here we come to motivational interviewing. I talked about this earlier as an introduction. This is client-centered counseling or client-centered providing of support, because this isn't only used by clinical people, it's used by non-clinical people such as recovery coaches as well. So motivational interviewing is an approach. I'm gonna forgo the word treatment because it's used in treatment, but it's also used in recovery support. It's an approach that helps individuals overcome ambivalent feelings and insecurities. The goal is to reduce the number of days of stimulant use, reduce the number of stimulants used per day, and approach is intended for use across gender, age, races, and ethnicity. A very powerful tool, which includes the understanding of stages of change. Once again, if you haven't been trained in motivational interviewing, we encourage you to get additional training. It is a really effective tool. Mentioned earlier, cognitive behavioral therapy, also known as CBT, has been in use in our field for a very long time. So CBT is a short-term, goal-oriented psychotherapy treatment that enables individuals to understand their current problems, challenges, and experiences in order to change their behaviors and patterns of thinking. This requires that the counselor, therapist, recovery coach, whoever the person is and what your title is, to be trained in CBT. And once again, can't say enough about this as a tool in our tool belt. So here it is, the 4th module summary, and this is the final module. Here's what we've learned. Addiction as the most severe chronic stage of substance use disorder diagnosis, which is characterized by substantial loss of self-control, manifesting in compulsive drug-seeking behaviors, despite the desire or attempts to discontinue those behaviors. Coke, crack, meth, speed, those are some shorthand terms for different types of stimulants that belong to a highly addictive class of drugs frequently used in the US and in other countries. Behavioral therapy is the most effective treatment for stimulant use disorder. One such method, contingency management, gives patients tangible rewards for positive behaviors, aiding their efforts to stop using stimulants. So that's the review of the fourth module. On behalf of the Latino and Hispanic Addiction Technology Transfer Center, we want to thank you for going through all of the four modules. Once again, we wish that you got information from all four that is going to be useful for you in your practice and in your agency. We want to encourage you to encourage other friends, other colleagues, co-workers to take the four modules. As you know, they're available on our webpage, and we want to thank you very much for participating. Muchas gracias, and I hope that our paths will cross in the near future.